Hello, everybody. Eric Wilson with ISO Health Incorporated talking today about the healthcare law. And did you get your cancellation letter like many people did? I got mine. My Blue Cross Blue Shield plan is being terminated December 31st, 2013, as are about another million, or, depending upon which report you believe, 16 million Americans getting canceled by their insurance company, which is contrary to if you like your healthcare plan, you can keep it, that the president touted in his town hall meeting in 2009. Nonetheless, some things you need to know. Okay, when you look at your new plans, first of all, a lot of companies are offering an early renewal. Renew your plan in December, keep it for another 12 months. That may be a good idea for you, depending upon your income. If you qualify for a government subsidy under the 2014 Affordable Care Act plans, that might be a good idea, depending on how much your subsidy is. Take note, a lot of the Affordable Care Act plans have a higher out-of-pocket maximum. My personal plan, when I looked at Blue Cross, the plan that they offered me, that they said was similar to what I currently had, the out-of-pocket maximum was $12,700. My current out-of-pocket max is $5,200. So that's a lot different in prices. It's not really like an apples-to-apples conversation. I heard, I think his name was Ezekiel Emanuel, Rob Emanuel's brother, who was involved in the writing healthcare law, apparently, and he was talking about the minimum standards and saying like, why wouldn't you want to plan with maternity, or why shouldn't the plan cover maternity, or why shouldn't it be a standard? The thing this healthcare law did, it looks like, is they really focus on the preventative care, which is important. Mammograms, pap smears, physicals are all important. Don't get me wrong, but they're not high cost. I mean, a normal physical is a couple $100. We can pay a couple $100 if we need to. The problem you have is on the high end stuff where you can't pay $12,000. That's where people get hurt. So take a peek at that. Try to keep your same plan if you can, if it's possible. Also, the fine, the tax that's out there. If you don't make enough money to pay a tax, if you're on your tax form, you lose money, or you don't get a tax return, an income tax return. As I understand it, you cannot collect the tax. They cannot collect it from you. So take a look at your tax form. If you're getting a tax return now, I've never been a big fan of getting a tax return. Quite honestly, I don't want the government to have my money, in advance. But if you're one of those people that do, look at changing your W-4, W-2, whatever it's called, your tax form. Give them a little bit, take a little bit more now, so you don't get a tax return. In the end, if there's no tax return, there's no tax to pay, no fine to pay. So something to think about there as you move forward. Also, I've never been the biggest fan of limited benefit plans. However, now some of them might make sense, especially for younger people that are under 27, 28. They're paying twice as much now for your health insurance. Perhaps the limited plan makes more sense for you. It should have just about everything that you need. A lot of those plans are a little weak in the chemo radiation side of things. And you would be taxed at the end of the year. They are not what are considered a qualified health plan, but there's a place for them now in that market. So things to consider as you look around. Eric Wilson, look forward to hearing from you soon. Bye.